Anteaters out there in the audience, welcome to Lunch with Eaters. We're very excited to have you. We see more and more registrants joining the event right now. So as more people trickle in, allow me to get the program started. I'm Jeff Menhas. I am Executive Director for Alumni Relations at the UCI Alumni Association. And I'm thrilled to welcome you today. We have a really exciting program with a really fascinating alumna who will be sharing insights for you and also talking about her UCI experience. So I'm really excited to get into that program. But first, some housekeeping notes. This is lucky number 13, the 13th installment of this series, Lunch with Eaters. It is a monthly virtual lunch and learn program, which is built specifically for you, the UCI alumni and friends community. So as I said, we're fortunate to be putting on a series of virtual programs, both this Lunch with Eater series and many, many others. So if you're just kind of coming into the community right now, please know that we have about 4 on average virtual events per week listed on our website and many more diverse topics that we put out there and featuring alumni in every case. So keep an eye out for more content. For this event, I want everyone to know in the audience that you are muted so that we can eliminate background noise. However, we highly encourage you to participate. So while you're audibly muted, type away on that keyboard, because what we're going to do is have a Q&A session at the end for about 15 minutes at the end of this hour. So as you have questions throughout the program, please enter them in the Q&A. We'll circle back and answer as many of those as we can during the Q&A session. I mentioned some of our virtual events that we have, but I also wanted to let everyone know that we have some other virtual opportunities to engage during this pandemic as well. One of those key opportunities is mentoring. You as alumni can volunteer as mentors to help students, especially in this great time of need for them, and younger alumni by paying it forward with your advice, with your mentorship. We have a wonderful platform that easily facilitates that. It's called the Anteater Network. So please check that out at antnet.uci.edu. We have many other virtual resources, downloadable content, benefits and programs that you might want to learn about at our Anteaters Go virtual page. We'll share the links to those in the thank you email that we send out after this event. So as I mentioned, we're going to have a fun program here. Submit your questions as they come. But with that, I am very excited to introduce our featured speaker. So I'm going to give a quick introduction, but please know that Dr. Ann Marie McNeill, our featured speaker, is essentially a 3-time alumna of UCI with her MD, PhD, and did her residency at UCI as well. Dr. Ann Marie McNeill is a board-certified dermatologist who founded Newport Beach Dermatology and Plastic Surgery in 2010 and is president of the medical practice. Her special interests are in skin rejuvenation, skin cancer, and vulvar dermatology. During her residency, Dr. McNeill was a recipient of the Women's Dermatologic Society Mentorship Program and studied vulvar dermatology at St. John's Institute of Dermatology in London, England. We're also very lucky to call her a board member of the UCI Alumni Association. So everyone in the audience, please join me in giving Dr. Ann Marie McNeill a virtual welcome as she comes onto the program. I hear lots of virtual applause in the background. Yay.
Thank you, Jeff.
Hi, Ann Marie, welcome. Yeah.
Thank you.
Well, it's wonderful to see you. Thank you so much for doing this program. We got tons of interest from the alumni audience. So a lot of people want to hear what you have to say with your specialty. So we're going to be excited to get into the program. But first, let's warm up the audience a bit. Talk, maybe if you can share, since we're all UCI alumni together, do you have a favorite memory or two of your UCI experience that you could share with us?
I would say Well, one of the happiest times when I was at UCI was actually when I was accepted into the medical school because, I had started in my PhD program after undergrad. I did my undergrad at UC San Diego and then came up to do the PhD at UC Irvine. And, I was one of those kids like many who I wasn't really sure what I wanted to do. And I applied to the PhD program and got in and started doing it. But I wasn't, I had no idea really what I wanted to do. And, I think I was afraid to apply to medical school straight from undergrad. I'd heard how hard it was, and I certainly didn't have the funding or resources to be able to do it. And I was just sort of intimidated by it all. But then when I learned about it, I took the med pharm and med physiology and the classes with the medical students as part of my PhD. I really realized that that's what I wanted to do. And I really had an amazing support from the UCI community in pursuing that. And for example, my program could have thought, well, we're funding you to do your PhD and we don't want you to go to med school, things like that. But no, everybody really came around and supported me. And, I started the medical program and I did this kind of combined program, and it was not what we had planned on doing, but it was really when I got that, I felt like I finally know what I want to do with my life, and I felt so supported by the UCI community in doing that. And that's really the fondest memory. I still have my letter of acceptance right there to medical school, and like not my diploma, but my letter of acceptance, because it's like, it meant so much to me that, I finally felt like it was, my place and what I wanted to be doing. And so that's really actually my fondest memory, when I finally felt like I had a path that was going to be good for me.
Well, that's truly wonderful. And it's great to hear for many of us, as it was with you, the university being very supportive and helpful along the way. Now, you as an alumna are being very helpful back to the university and the UCI community. You've gotten re-engaged as an alumna, as an ambassador and a leader with the Alumni Association.
Mm-hmm.
What has your experience been like doing that, getting re-engaged as an ambassador in the alumni community?
Well, as you know, especially, I'm still in Orange County, and, we're everywhere. The UCI alums are everywhere in Orange County and beyond, of course. So now that I'm re-engaged on the alumni board, I really sort of see how much our graduates are in positions of leadership, all over. And so it's really sort of helped me in my career to become re-engaged with these people, through different ways, through the alumni network. And, now I'm at the age where even my children are applying to colleges and on that pathway. And so it's been really interesting for me to, when you're first applying to undergrad, you're thinking about it as just your undergraduate experience, but really we should think about college as your undergraduate experience, but also, you're an alum for the rest of your life. And so, I'm helping my kids and friends see that as part of when they're applying to college. It's not just for their undergraduate experience, but for their alumni experience the rest of their life, which is equally as important.
Well, thank you for sharing that. That is a very important message. We have more than 200,000 UCI alumni around the world. And you're right, particularly here in Southern California and Orange County. So many ways for other alumni to get involved as you did. So we're thankful that you are so involved and engaging your community as well. So perhaps let's talk about your specialty and how you kind of evolved, especially since you mentioned before, not knowing exactly what you wanted to do when you were applying to PhD in medical school. What drew you to dermatology?
Well, in medical school, lots of people go thinking they want to be a surgeon or they want to be a pediatrician or whatever, and most do not end up doing whatever specialty they originally went to medical school to pursue. And it's a testament to the way the training goes, is that you rotate through all these, common specialties and subspecialties, and you really get to see, you learn from each of those, but you also see sort of what your life would be like as in that specialty. So in dermatology, I saw all the procedures that we can do, all of the surgeries for skin cancers, but also the new technologies, the laser devices that are always new and changing. And so those were the things that I really enjoyed. I like doing surgeries and procedures, and I like technology a lot. And those were sort of the two things in derm that I saw that really drew me to it.
Great. Well, I'm sure we're going to learn a lot more about the specifics and what you focus on in your business momentarily. So I'll take that opportunity to shift us to our next phase of the event. But first, we have a poll for the audience to get to interact a little bit. Have you noticed skin changes during this time compared to pre-COVID, before the pandemic? Please go ahead, take 10 seconds to answer that question. Everyone in the audience, you should see it pop up, yes or no. We'll share that those answers momentarily, but that is something that maybe not everyone has noticed, but something that may be affecting you now. So let's go ahead and see what those results are. And 70% of the audience has noticed changes in their skin during this time compared to before the pandemic. Only 30% have not. So that is fascinating. We may be learning why. So with that, Ann Marie, I will turn it over to you. And again, final reminder to the audience, submit those questions along the way and we'll come back to them. So Dr. Ann Marie McNeill.
Thank you. So we'll put up a PowerPoint where I'll talk a little bit about some skin changes that we're seeing during the pandemic. Also some tips in general about skincare at home and things we can do for our skin during the pandemic. Next slide, please. So there's two common skin conditions that we are seeing a lot these days. So since the pandemic, one is what we're calling maskne, and I'll go over that term and what it can represent. And then hand dermatitis as well, largely from the increased hand washing. So these are things we need to do to protect ourselves from getting the virus, wear a mask and wash our hands, but they can also lead to some skin problems. And so we'll talk about how we can treat those. Next, I'll talk about some skincare, just sort of like basics that I generally would go over with all my patients, even not in a pandemic, some basics about taking care of your skin. And then I'll address trends in skincare in general during the pandemic. Since we're all on Zoom and working from home, it's brought up some other sort of procedures and things that people have an increased interest in these days. Lastly, I'll give a slide with some of my advice, but the basic of it is just to keep going, keep working hard. It all works out. And then last, we'll do some Q&A. So I just wrote, bring it on, because, feel free to type in any questions in the chat. Next slide. So the first thing we'll address is maskne. This is a diagram which sort of addresses what we're seeing, an example of maskne. The term maskne really refers to any rash that people are getting under, in the distribution that the mask lies. But I guess what I'm going to go over is that it's not really one condition. It's a variety of conditions that are, coming up in people related to mask use. And so I'll go over different causes of rashes under the mask next, and then the basics on how to treat them. So maskne in general, like I just said, is multifactorial. There are a number of skin conditions that can cause a rash under the mask. And it sounds like people are getting skin conditions related to the pandemic from your poll. Of course, we may have a little bit of selection bias in that poll because people who registered for this talk maybe are getting skin changes, but I'm glad that you're all here and interested to hear about it. So the first and probably the most common cause of maskne is a rash called Peri-Oral Dermatitis. And we'll talk more about that, but that's probably what most cases of maskne are. But also some cases of maskne are due to an allergic or irritant contact dermatitis. There's other cases of maskne that are literally just somebody who already had acne, but it's flared, sort of maybe partly due to the mask or just the pandemic in general. And then, of course, people can have normal rashes. They can have skin cancers under their mask and some damage and other rashes too. So sometimes people come in saying, oh, I have maskne, but really it's actually a skin cancer that, sort of would have been growing there anyway. And maybe they're just noticing it because it's irritated from the mask. So next slide. So this is the most common form of what people call maskne, and it's a rash called peri-oral dermatitis or peri-orificial dermatitis that people, certainly got peri-oral dermatitis before we were all wearing masks. It's a very known condition, but it seems to be much, much more common now. And it's really just the heat due to mask wearing that, it gets warmer under there, and that triggers the peri-oral dermatitis. Peri-oral dermatitis is a form of rosacea. So it's an inflammation of the skin. In people who don't wear a mask, generally it's around the mouth, around the nose, and even around the eyes. So another term for it is peri-orificial dermatitis, because it'll be around the orifices on the face, the mouth, the nose, and the eyes. And you can see how I have photos of those there, but generally when it's called maskne, it's really just around the nose and the mouth. And there's certain characteristics of it that you might note. For example, on this woman around her lips, it spares the skin immediately around the lip. It sort of skips an area, and then it goes really more down on the chin and little patches around the corners of the mouth. But generally it will not go on the skin that's immediately bordering the red of your lips. So it'll skip an area, it'll spare an area, and then start in these pink patches and bumps that sort of look like acne, but they're not acne, they're different. They're this peri-orificial dermatitis. And then it'll go around the openings of the nose as well. This is a very classic picture of perioral dermatitis or maskne. And when people have it more severe, it'll start to be around the eyes too. Again, triggered probably by the heat of the mask. Next slide. There's another form of maskne that's really just a irritant or allergic contact dermatitis. So this will show up really in the pressure points of where the mask is rubbing or in contact with the skin. So especially on the nose, people will even develop sores there with an erosion from tight-fitting masks. I certainly have gotten nose sores just like this earlier on in the pandemic, before I really knew how to manage wearing a mask all day long at work. And it'll sometimes go around the neck where the mask is in contact with the skin. So that's another form of maskne. And next slide. And then a third form is really just an acne flare. So this would be somebody with underlying acne who, now the acne, is just a lot worse during the pandemic. I don't think masks in particular make acne worse, but I think all of us, our lifestyles have changed a bit, and sometimes changes in diet and other things can trigger a acne flare. Next slide. So there are conservative treatments for maskne that I can go over now for all the different forms of maskne, depending on the etiology of it. If it's a peri-oral dermatitis that's triggering the maskne, so again, that rash that spares just around the mouth and is around the nose openings as well, you want to avoid triggers or things that can flare peri-oral dermatitis. So things that can trigger peri-oral dermatitis are irritant medications. for example, benzoyl peroxide or retinoids or salicylic acid, you really want to avoid those. So sometimes people think their perioral dermatitis is acne, and so they'll treat it with benzoyl peroxide or a retinoid, but actually that'll make it worse. So you want to avoid any of those acne type of medications. You also want to avoid topical steroids. So sometimes people put on some hydrocortisone thinking it's just an irritation. But although a hydrocortisone would temporarily sort of suppress it a little, you do get then a rebound effect later, and it will make perioral dermatitis worse. So that's why this condition can actually be really, really frustrating to people, because whatever they do to treat it seems to make it worse or persist. So to treat perioral dermatitis, you want to use very calming skincare. Cerave or Aven are good brands that are very calming with hyaluronic acid and ceramides, which are calming to the skin. And later I'll show some examples of what to look for in these skincare items, but calming skincare and avoiding the triggers. And then if that doesn't work, you do really need to be seen by a provider. You might want to see the dermatologist, because most of the treatments for perioral dermatitis, besides what I've already talked about, are prescription medicines. So we'll use an oral antibiotic called minocycline or doxycycline, or sometimes one of the topical versions, but those are prescription. And that, that's a prescription treatment for that most common cause of maskne. And then the next one would be that allergic or irritant contact dermatitis that can trigger maskne. And the treatment for that is really just to limit the contact of the mask with the skin. Don't limit wearing a mask because you have to wear your mask, but you want to use a barrier where it hits your skin. So we'll apply some Vaseline or another ointment, where the mask will hit the skin, or even one of these adhesive tapes like Duoderm, or that's like what K-tape is, what the kinesiology, tape that people use. You can apply those to your nose. That's what I usually do. I just put a tape on my nose where the mask hits, and that'll keep my nose protected. And then the last form of maskne is really an acne flare. People who are prone to acne, they know they have acne, and it's just gotten worse due to like acne does, it kind of comes and goes and will flare with dietary changes or just for no reason at all, really. But things that can trigger it is, if you're wearing makeup under your mask, you really want to not do that. You always want to have a clean mask, so wear a clean mask every day. And then if it's an acne flare, you really do want to use these over-the-counter acne medicines like benzoyl peroxide, salicylic acid, or adapalene gel. Brand of adapalene is called Differin, but these are all available over the counter. You can buy them at Rite Aid or Target. And those are good treatments for acne. And then if it didn't respond to that, then that's when we would consider, go to the dermatologist. And there's laser treatments actually for active acne now, and oral medications, depending on the severity. So lots of things we can do for acne. We never want to let people go with acne untreated, as it can lead to scarring. And there's lots of very, very effective treatments for acne out there. Next slide. So the next, the other common skin complaint during the pandemic is this hand dermatitis. Of course, like we have to wear a mask, we have to wash our hands, but that's leading to a lot of cracking and drying. And this picture shows these kind of red patches, often along the knuckles and sides of the fingers, that can actually be really painful and cracking and hurt from frequent hand washing. Next slide. So hand dermatitis can happen with anyone who washes their hands frequently, but often it's worse in people who have eczema or atopic dermatitis normally, sort of on the rest of their body. And then when they start washing their hands more, they get this chapped on their skin. So it's this dry, chapped and cracking skin. And it's really that the skin barrier has been completely disrupted due to the soaps from hand washing. And it can become painful when these little fissures develop in the skin, and bacteria can actually grow in these fissures, causing what we call a super infection. And that can be very, very painful. And so we want to try to get ahead of hand dermatitis before it even really starts. We want to try to treat it, when it's in a more mild form before these little cracks start. Next slide. So treatment of hand dermatitis is, well, it says wash with soap. That's actually not the treatment for hand dermatitis. That's what causes it. But I don't want you to stop washing with soap, because that's detergent, soaps with detergent in them, like most of the bar soaps and liquid soaps that we use are, the best way to kill the virus. They're even better than hand sanitizer. So we're going to still wash with soap, but then after we wash, we're going to pat dry with a paper towel or towel, but pat dry really makes a difference compared to like rubbing with a towel or a paper towel. That's going to make a hand dermatitis a lot worse. So pat dry, and then every single time you wash your hands, you want to apply moisturizer generously. And that's hard to do. You really have to carry a moisturizer with you. A good one is Cerave, because it has ceramides and hyaluronic acid, but you want to really carry a moisturizer with you and apply it every time you wash your hands. And then if it's a little more severe, you can also add using over-the-counter hydrocortisone twice per day as well, as that will help the eczema in the hand dermatitis. So, so those are the main treatments: hydrocortisone twice per day, and a good moisturizer like CeraVe every time you wash your hands. Now, if it's gotten to the point where there's these cracks and fissures and it's painful, that's when you would need to come in. There's oral antibiotics and oral medications or injections we can do to get it under better control if it's severe. But again, these are the things you can try at home. Next slide. All right, so switching gears a little bit, we'll talk about the basics of skincare at home. And these are the things I like to go over actually with all my patients, the basics about good skincare. 3 things, very easy. Sun protection every day, which that means sunscreen every day, and sun protection like a hat or a shade, structures, but protecting yourself from the sun. Using a topical retinoid nightly, that's a cream that we'll go over. That is also an important step for good skincare. And the last is don't smoke. So 3 most important things for taking good care of your skin. Next slide. So sunscreen, this slide has 4 very important points on it. The first one, that's the most important to me, is that daily use of sunscreen decreases all forms of skin cancer. The 3 most common forms of skin cancer. Those are basal cell carcinomas, squamous cell carcinomas, and melanomas. I treat those every day. In Southern California, very, very, very high incidence of skin cancers, and at younger and younger ages too, even in the 30s. Of course, they go up as the years go by, but daily use of sunscreen decreases the incidence of all of these skin cancers. And a lot of people, when I ask them, they say, yeah, I use sunscreen every day. I use it when I go to the beach. And that's not really using it every day unless you go to the beach every day. So the next point is that intermittent or occasional use of sunscreen does not reduce the incidence of skin cancer. So if you just use it when you go to the beach, but you don't use it every day, you're not reducing your chance of getting a skin cancer. So we want to use it every day. We think that this is because most sun damage is sort of cumulative over the years. It's 10 minutes, when you're in your car, and 10 minutes when you're walking into the store or walking into your office. So you might feel like you're indoors all day, but you're not really indoors all day. So we want you to use the sunscreen every day. And then the next point is that daily use of sunscreen also reduces brown spots and wrinkles and keeps you younger looking. So if I can't appeal to your, desire to reduce skin cancer in yourself, I would like to appeal to your vanity and trying to convince you to wear the sunscreen every day, because it really does have cosmetic benefits as well. And then the best forms of sunscreen, are the mineral-based sunscreens. And again, I'll show you some examples of products in a minute that I recommend. But the ingredient being zinc oxide, and or titanium dioxide as the mineral-based sunscreens. Those are going to be the best protection from the sun. The ones in the photo are all mineral-based sunscreens, but lots of the ones that you'll see at the drugstore are not mineral-based sunscreens, and they're chemical sunscreens. And chemical sunscreens will reduce your chance of a sunburn, but they won't reduce, they won't have the anti-aging and anti-skin cancer benefits that a mineral sunscreen will. Next slide. Oh, this is my data for you, arguing for wearing sunscreen every day. And this is appealing to your vanity. So the x-axis, so at the bottom, we see texture, clarity, crow's feet, pigmentation, and then, as time goes on over a year, so the time course being a year with the intervention being daily use of sunscreen. And, on the y-axis, you'll see the mean % of improvement. So if you look at the column sort of in the near the middle of mottled pigmentation, you'll see that, after 52 weeks of sunscreen, a drastic improvement in baseline in terms of pigmentation in the skin. No fancy lasers or any of this stuff is done, just wearing sunscreen every day. And these benefits are for fine lines and wrinkles and just overall appearance, so skin clarity and evenness. So that's a good reason to wear your sunscreen every day. Next slide. And then the second recommendation that I had was use of a retinoid. So this is a picture of before and after of somebody using a retinoid cream nightly. So, and I'll go over some examples of retinoids, but retinoids are, they're either over the counter or prescription. There's both, but they reduce acne. They're, most of them are FDA approved for acne, but they also reduce fine lines and wrinkles. They help you to build collagen, they even your skin color. So retinoids have a lot of benefits in skincare. Next slide. And these are the ones that, 3 examples of common retinoids. So the mild and the mid that you see there are examples of Rock and Differin or Adapalene. Those are over the counter now. The Differin one used to be prescription, but now it's available at Target or Rite Aid or anywhere. And you can buy that. They're marketing it as an acne treatment, but it's also an anti-aging treatment. So the mild or mid-strength ones are Rock and Adapalene. And then the stronger ones are prescription only. We have an example here of tretinoin. Another prescription one is called tazarotene, but those again are creams that are retinoids that are prescription only. Next slide. And using a retinoid nightly, again, has all of these benefits, but there is a drawback. These retinoid creams are drying. So a lot of people will start to use them and then their skin gets too dry and they stop. But generally we'll recommend just use it 2 nights per week, pea-sized amount or less for your whole entire face, 2 nights per week for a whole month, and then gradually increase the frequency. So the next month you might use it 3 nights per week, and the next month you might use it 4 nights per week, and gradually your skin should retinize and you should be able to use a retinoid nightly. But it does have a lot of benefits for your skin. And then the other thing, pretty obvious, but to counteract the dryness, you can use moisturizer along with it. There's studies showing you can use Cerave. You could even put on the Cerave first and then the retinoid, and it does not decrease the efficacy of the retinoid. So you can use lots of moisturizers along with the retinoid to increase the tolerance of them so that you can, tolerate them and get the benefits that we're looking for from the retinoid. And next slide. These are just, more pictures of the benefits of about a year's use of retinoid. So you can see on the right, the difference before and after in terms of less wrinkles around her eyes. In the middle, you can see less wrinkles on the cheeks and the eyes. So the only intervention here being using a retinoid nightly. So it really has a lot of benefits for anti-aging and quite simple if you can get around the dryness. And next slide. And the last one is not to smoke. We all know not to smoke. People have told us, but people still do it. And so I have to put it in here. Smoking increases skin cancers for sure, without a doubt, and also skin aging. And it doesn't matter if it's cigarettes or if it's vaping, you know, it's the nicotine. And smoking definitely accelerates skin aging and skin cancers. This picture is kind of just catches your eye because they're identical twins who were raised in the same area. Have largely the same amount of outdoor activities, you know, both live in sunny climates. And you can see the woman on the low right with much less signs of skin aging, less wrinkles, less laxity, overall just healthier skin, with the only real difference being that she doesn't smoke and her twin sister on the upper left does. And next slide. Oh yeah, so now I want to show the, if you could take off the PowerPoint, and I just want to show some products that you can look for, what to look for in sunscreen. So these are some sunscreens that you might see sort of at the drugstore, and they all look good and they look healthy, and you don't know which to pick. You're looking for the mineral sunscreen. And so you have to look closely. It's not going to say on the front that it has zinc oxide or titanium dioxide. You really have to pick it up and you have to turn it around to the little box. Usually it's at the top that says drug facts. And you have to look closely at the active ingredients. This is a little blurry here, but I'm going to tell you what this one says, drug facts. Avobenzone, homosalate, octisalate, octocrylene, and oxybenzone. So this is the kind you don't want to get. It looks healthy. It'll protect you from getting sunburned, but it doesn't have those other benefits with anti-aging and with skin. It has less of the skin cancer reduction benefits. So we really like people to use the mineral sunscreens. They're better protection, and you know, there's no reason not to. So this is an example of one that's a mineral sunscreen. Generally on the front, it'll at least say like pure or mineral. But then again, you flip it over, you look for that sign, that part that says active ingredients, and it'll just say zinc oxide, you know, and or titanium dioxide. Could be one or the other, mixture of the two, but it does make a big difference. If you're putting on sunscreen, just take that extra step and pick the one that the kind that works the best. And then as far as a retinoid, I showed a picture of it, but this is one brand that this used to be a prescription product that was, you know, hundreds of dollars. And then I think maybe 3 or 4 years ago, they made it available over the counter. And again, this is a retinoid that's not that drying. It's a nice one to start with because it's sort of mid-strength where it won't be too drying or irritating, but still just start off a couple nights per week and then increase the frequency. But the generic name is adapalene. I don't care which brand you get, but you know, adapalene is the generic term. This is the brand different, but there are other brands and they all work very well. So that's sort of a mid-strength one. And then there's the prescription version, which is tretinoin. There's other prescription ones as well. This is going to be a little bit stronger, but you would need to see someone for a prescription. But those are very powerful for topical anti-aging creams. And just lastly, I'll show this brand as well, because this is generally going to be a go-to brand for facial cleansers or moisturizers. Cerave, again, at one point was a prescription product because it has these ceramides in it. Now there's more brands that have that as the technology, but very hydrating and calming. This would be, if you had a mild case of maskne, you would start off with just washing your face with Cerave cleanser and then using a Cerave moisturizer and seeing if that helped. If that didn't work, then of course we would need to do some of the prescription medications. And also the Cerave moisturizer would be a great treatment with topical hydrocortisone for the hand dermatitis as well. All right, so we could probably go back to the presentation, or should we take a break here, Jeff?
Well, we have a lot of questions, a lot of specific questions. So there are more than enough to probably last us till the end of the event. So it's up to you, Ann Marie.
Maybe I'll just like touch on the things people are doing during the pandemic, and then we'll go to the questions. How does that sound?
Okay, sure. A couple more minutes. We'll go back to the slides.
Okay, so we can put up the slides. Next slide. Most of you would, yeah, so what's popular during the pandemic is that we're all doing exactly what we're doing now and Zooming. And, you know, I don't know if you guys see your faces right now, but I certainly see mine. And I'm hearing this all day long, is that I didn't know I had this big, you know, brown spot on my cheek, or did my wrinkles really look that bad? And, you know, it's hard because psychologically, it's hard to be looking at yourself all day sometimes. And you know, how much do we really, you know, obsess about, you know, one little wrinkle or one little brown spot? Uh, you know, we don't have to be obsessed with it on one hand, but on the other hand, there's not a lot that we can do for ourselves as sort of like a treat or a nice thing to do for ourselves safely these days. So, you know, Zoom has sort of triggered, I think, a heightened awareness of people's cosmetic issues and a heightened, you know, interest in getting some of these procedures done. So next slide. And this is just an example of Botox, which treating the forehead and fine lines around the mouth. And what Botox does is just reduce movement of the forehead and the, you know, the glabella, the lines between the eyebrows, and just smooths the skin. Next slide. And this is an example of some fillers that people do sort of before and after for the little fine lines around the mouth. These are things we can do in the office for helping with wrinkles around the lines around the mouth. Next slide. And again, an example of what Botox before and after Botox and fillers can do, sort of some facial slimming of the low face and plumping of the lips and opening up the eyes with these products. Next slide. And lasers for removing brown spots and things. So a lot of times people are getting, like, never notice that they had brown spots on their forehead until they're sitting there staring at themselves all day long, which is, you know, unfortunate. I can't wait till we don't have to do this anymore. But it is nice to know that, you know, we can remove some of these things very safely. Next slide. And then lastly, the other thing that's popular during the pandemic is just staying at home. And since we're staying at home, we do have a little bit more time to recover from procedures if we do have them done. So one of the favorite procedures that I do is called Fractionated Co2 Resurfacing. It's a way, it's sort of anti-aging, but it also sort of resets the skin, gets rid of all the sun damage and even precancers that some of us have from years of sun exposure in our youth. But you are really red for a week afterwards. And since lots of us are working from home nowadays, we have more time to recover, and, you know, we still can work just fine, but we look silly for a week. But we could do that at home. Next slide. So the fractionated CO2 is a laser that really ablates the skin in these little columns, and then your skin just kind of, you can see at the bottom, this is a transection of skin, but it creates little holes in the skin, and then it stimulates your body to repair itself, and then it looks more smooth after it's healed itself, but it takes about a week to heal. Next slide. So these are some examples of before and after these kinds of laser resurfacing procedures. Next slide. And again, that's similar too. So those are some nice things that people are doing for themselves during the pandemic. All right, I think we could stop there.
Okay, thank you so much for all of that level of detail. We covered a lot, Dr. McNeill. We have so much more, many specific questions. I'm going to keep myself on video mute, not because I'm recovering from a skincare treatment, but just so I can see the questions better, because we have so many good ones. I'm going to start with one from Piolohia. Hi, Pyle. She's another wonderful alumna volunteer and event presenter, but she asked a pertinent question about the industry. So how do you find a dermatologist that is focused on recommending proper skincare routines as opposed to selling the latest and greatest fad?
That's a good question. I think it's important to be, as a patient to be sort of upfront about what your interests are. So some people come to a dermatologist wanting, the dermatologist to provide a whole new skincare regime for them and, a bunch of whatever procedures. And other people, want some recommendations for some things that fit in their budget better, or whatever the concerns are. So I think wherever you go, you want to be upfront about what your needs and expectations are from the visit. So I would say that. And then, but as far as picking the person that, the doctor or provider themselves, it's hard to know. I mean, you can look at people's websites and look at their reviews and ask friends. Those are really my recommendations. I would definitely see someone who's a board certified dermatologist. I wouldn't see, somebody who's sort of just developed an interest in skincare. So I would look for that, board certified dermatologist, and then look for their reviews and things online. But then when you pick someone and go, you explain what your needs are and what you're looking for, and I think that in general you'd be getting some honest opinions.
Great, thank you. Now I'm going to try to rapid fire. We have some great questions about sunscreen, since you spent time talking about how critically important it is. Yaneli Sanchez asks, what mineral sunscreen is recommended for darker skin? Because they leave me looking like a ghost, and I can relate to that as well.
Yeah, so mineral sunscreens, zinc oxide and titanium dioxide can be really white, but there's now, and it used to be that it was like what the stereotype of a lifeguard with a white nose had zinc oxide on his nose, but now they have all these transparent formulas of zinc oxide, but the tinted ones are generally the best for people with skin of color. So there's lots that are tinted, and they really actually kind of go on, like some women will like them as like sort of a light makeup. And then they have some for men that still have a slight tint, but not as much, don't look like makeup. So some brands that have that are Revision, Tetra, Color Science. Those are brands that have mineral sunscreens that have nice tints to them that go on nicely. And even at Ulta, like Ulta Beauty at Fashion Island, they have good tinted sunscreens with multiple shades, so you can really pick one to match your skin color as well. That's their brand called It's It, or It's Me, or something like that. So tinted sunscreen is generally the way to go for a mineral sunscreen and skin of color.
Okay, great. Iris Leong asks, if we're wearing a mask outdoors, do we still need to apply sunblock underneath, or can our mask shield us from the UV rays?
The mask generally will shield. So the mask has tight enough, if it's a good enough mask that it's protecting you from coronavirus, it has a tight enough weave that it'll protect you from the sun. And so that's a great side benefit of masks.
That's great news. Okay. One more sunscreen question for now. Pyle Lohia again asks, is sunscreen and foundation or a moisturizer enough, since they typically have SPF 30, or does it have to be additional to that or a higher SPF?
Yeah, that's a good question. Generally, people don't put on enough foundation to protect them from the sun. Generally, people put on enough moisturizer to protect them from the sun. So it's all about sort of the quantity or the volume that you're putting on. But yeah, if it's a moisturizer with a SPF 20 or 30, that is more than enough protection from the sun, or protection, that's more than enough sunscreen. It's the makeup that people, don't put on that much makeup. They're just putting on, a little pump. That's not going to be enough of the product for the full face. You want like half of a teaspoon in terms of the volume of product that you're putting on.
Got it. Okay, Natalie Krang asks, some sources have stated that blue light causes skin blemishes and discoloration. Skincare brands such as Kula advertise a line that prevents against this damage. Are these claims true?
Yeah, that's a good question too. Yes, it's not as important of a factor as the ultraviolet rays are that we get from the sun, but blue light can certainly contributes to skin aging. And so most of these mineral sunscreens and mineral makeups, getting back to the last question, do also have a ferric oxide in it, so like iron. So they'll have the zinc, the titanium, and the iron. And the iron oxides do protect against blue light. And so, yes, I do think that that's also important, not as important as the ultraviolet protection, but I do think it's also important.
Great. Okay. Sophia Lynn asks, does retinoid make your skin photosensitive?
It can make your skin a little red when it gets dry or irritated. So people will think they look like they have a sunburn sometimes if they're using retinoid a little bit too much, but it won't really make you photosensitive. The thing about retinoids is that they are broken down by the sun, the cream itself, a retinoid. So you want to apply your retinoid at night before you go to bed. If you put it on in the morning and then go out in the sun, the medicine itself is broken down by the sun. So, so you want to apply your retinoid at night, but it won't make you it won't make you sunburn more easily. It just might make you look a little pink if you get dry from it.
So back to one of the things you touched on earlier, Kimberly Flores asks, would you say that one-use masks can help your skin, or is it just the same as wearing a reusable mask?
Oh, like the face masks that we're wearing,
Yeah,
like these.
Like disposable versus ones that you wash.
If you wash them, and like, for example, acne prone people really need to make sure they're washing their mask if they're using reusable masks. So I would say either using a clean mask or washing a reusable mask. Either one is perfectly fine. We just want it to be clean.
Got it. Okay, Natalie Krang asks, has there been scientific proof of the validity regarding a skincare line's claim that there are antioxidant benefits from black tea and kombucha ingredients?
I'm not sure if that refers to them being topical versus oral, but there are certainly antioxidant benefits of drinking those ingredients. Used as topicals, I'm not sure. Green tea has topical antioxidant benefits. I don't have any experience with any topical kombucha. But in general, so I talked about the two most important topical things, which is sunscreen and retinoid. But if we were to make three, it would be sunscreen, retinoid, and topical antioxidants. Like vitamin C and E are the two sort of most important topical antioxidants. I don't think we need tons of topical antioxidants. So generally, if we're recommending an antioxidant, I would go with the vitamin C and vitamin E creams. Got
it. Okay. More practical question here. Pia Noguera asks, besides the price tag, is there a significant difference between drugstore brands and designer brands like those found at Sephora?
In terms of sunscreens, probably.
Yeah.
I think, the ingredients in like the ones, there's sunscreens, honestly, that I sell here that are close to $100. And they have the active ingredients are the same. They're the zinc oxide and titanium dioxide, which you can find at, Sephora or even at Target. Generally, the advantages are going to be, for the more expensive ones, are with the sort of aesthetics of them, of how nicely they go on. And we all know that people don't really wear them every day unless, they like the look of it and the way it goes on. So, so to answer the question, no, I don't think there's any benefits to the more expensive ones, as long as they're the zinc and titanium sunscreens, if you're going to wear it every day.
Great. Okay. I think we have time for one, maybe two more questions. One comes from our colleague and friend, Nico Dye. What is your advice for acne scars?
Acne scars are hard to treat. So acne scars, you have to do these fairly aggressive laser procedures in general. So what I was talking about at the end, that fractionated CO2, where you look really red for about a week, that's going to be sort of the gold standard treatment for acne scars. And that's where, and when I say that, I'm referring to acne scars that are true scars, they're indents, in the skin. Some people have what they'll call an acne scar, but it's really just a brown spot where acne healed. That we can treat with sort of topical creams and peels and stuff like that. But if it's truly a scar, a change in the texture of the skin, we have to do these laser resurfacing procedures, which generally involve quite a bit of downtime. Retinoid cream, like the ones we were talking about, those will help acne scars a tiny bit. So it's probably, if you have acne scars, it's good to use that, but generally won't be quite enough. Acne scars are hard to treat. Generally, you have to have quite a bit of downtime to get rid of them.
There's so many good questions I want to get to. I'll have one more here from Alejandra Lopez. What are your thoughts on preventable Botox? She's heard both sides. She's 24 and has gotten some light Botox and really liked it.
So that's Botox and fillers in general, and people in their 20s and early 30s is become a lot more popular, and with good reason. It definitely, filler is not preventative for anti-aging, but Botox is. So if you are noticing that you're starting to get a line sort of right on your forehead here or between your eyes, and it's just starting, and if you can get a very small amount of Botox, so it's not too terribly expensive, and it will stop that line from becoming etched in. And generally, if you're starting to get a line and you don't treat it, we know it's just going to get more and more as time goes on. We can all look at our parents or family members that are older than us for signs of how we're going to age, and these lines that start, they only get deeper as time goes on, and Botox definitely prevents those from getting more etched in on the upper face. So generally here on between your eyes and around the outsides of your eyes. The filler, a lot of the 20-somethings are getting filler in their lips, and if they like it, it's cute and that's fine. They like the looks, but it's not going to be preventive for anti-aging.
Thanks. And one very last question from Elizabeth Beach. Sheet masks, helpful or just a useless
It's 1 o'clock.
The masks that you can, buy at the store as like a treatment for acne and for hydrating your skin, they can certainly be very effective. They tend to keep the product on for longer, and they sort of, because it has that sheet, it pushes the product into the skin deeper. So that's why they are effective. Anything topical that you put on, we call it applying medicine under occlusion. So if you say you needed hydrocortisone on your finger, well, if you put on the hydrocortisone and just rubbed it in, or you put on the hydrocortisone, but then you wrapped tape around it, if you wrap the tape around it or saran wrap, that would make it penetrate into the skin more deeply. And so it's the same idea with these sheet masks. You put the product on, but then you have this sheet over it. It allows the product to penetrate more deeply, and you're going to get more benefit from it. So yeah, it's kind of a popular trend right now, but it definitely does work.
Wonderful. Well, Dr. McNeill, thank you so much. That was a ton of information over the past hour, and especially rapid firing through those questions. I think everyone appreciated your detailed answers. So thank you so much. With that, everyone in the audience, please join me in giving another one of those virtual rounds of applause for Dr. Ann Marie McNeill for taking the time. Thank you so much, Ann Marie. We really appreciate it.
Yeah, thank you for inviting me. Thanks for all the questions.
Wonderful. Well, it's our pleasure. Really quickly for the folks in the audience, I think we're going to have a quick pop-up poll. We just love your quick feedback on this event before we wrap. We just want to know what other types of events you'd be interested in attending. As we continue to round out our engagement opportunities, please take a moment to do that. While you answer that survey, our next Lunch with Eaters is going to be held on Friday, December 11th from 12 to 1. If you do have further questions, if you want to follow up with us, feel free to email those to alumni@uci.edu. And then finally, a recording of this webinar will be provided in the thank you email. So every registrant will receive that within the following week, and you'll be able to reference back some of Dr. McNeill's points and details. So look out for that. And once more, finally, thank you again, everyone in the audience, for attending, and thank you, Dr. Ann Marie McNeill. We will see you later. Have a great weekend and stay safe. Thanks, everyone.
Thank you.